Pharmacotherapy is the disciplined application of medications to prevent, manage, or treat diseases and health conditions. It is a central pillar in clinical medicine, influencing how healthcare providers approach patient care and optimize health outcomes. This presentation will explore the multifaceted principles guiding pharmacotherapy, rooted in evidence-based practice, patient-centered considerations, and a continuously evolving body of scientific knowledge. Understanding how drugs work, how they are metabolized, and how they interact with other drugs is crucial. Integrating clinical guidelines, research data, healthcare economics, and patient factors forms the foundation of clinical decision-making. A holistic approach considers patient physiology, comorbidities, severity of condition, and potential drug interactions. Therapeutic outcomes are tangible or measurable endpoints reflecting a patient's health status following an intervention. They serve as critical markers guiding healthcare professionals in selecting and adjusting treatments. For example, in hypertension management, reducing blood pressure below 140/90ths of a millimeter of mercury is a key outcome. Therapeutic outcomes can be categorized into clinical outcomes, patient-reported outcomes, and economic outcomes. Clinical outcomes are objective measures like blood pressure readings. Patient-reported outcomes include subjective measures such as pain levels and quality of life. Economic outcomes assess the financial impact of treatments, such as reduced hospital readmission rates. Therapeutic outcomes guide treatment decisions by acting as benchmarks against which all pharmacotherapy decisions are measured. They enable personalization by allowing continuous outcome assessment and help identify and mitigate adverse events, ensuring patient safety remains a top priority. Measuring therapeutic outcomes involves various endpoints. Clinical endpoints measure direct health status changes. Surrogate endpoints use indirect measures like blood biomarkers. Patient-reported outcomes capture subjective measures through surveys. Composite endpoints group several outcomes to provide a comprehensive picture of effectiveness. Several factors shape therapeutic outcomes, including patient-specific characteristics like age and genetics, medication adherence, drug interactions, lifestyle factors, and healthcare provider engagement. Each of these factors plays a crucial role in the efficacy and safety of treatments. Evidence-based practice in pharmacotherapy ensures patient care is informed by the best available evidence. It integrates clinical expertise with high-quality research evidence and patient values. Key components include best available evidence, clinical expertise, and patient values and preferences. Implementing evidence-based practice involves formulating clear clinical questions, searching the literature, critically appraising evidence, integrating evidence with expertise, and evaluating outcomes to refine approaches. This structured approach ensures that patient care is continuously improved based on the latest research. Research evidence in pharmacotherapy includes systematic reviews, randomized controlled trials, cohort and case control studies, cross-sectional studies, and case reports. Each type of research provides different levels of evidence and insights, contributing to a comprehensive understanding of treatment efficacy and safety. Critical appraisal of research evidence involves assessing study validity, evaluating results, considering applicability, and ensuring consistency with previous research. This process ensures that the evidence used in clinical decision-making is reliable and relevant to patient care. Applying evidence to clinical decision-making involves balancing research findings with patient factors, adapting guidelines to individual patient needs, and engaging in shared decision-making. This approach ensures that treatments are tailored to each patient's unique situation and preferences. Pharmacoeconomics evaluates the economic aspects of healthcare interventions, aiming to identify treatments that provide the greatest value by maximizing health benefits relative to their costs. This is crucial for making informed decisions about resource allocation in healthcare. Key pharmacoeconomic analyses include cost minimization analysis, cost effectiveness analysis, cost utility analysis, and cost benefit analysis. Each method evaluates different aspects of economic efficiency and patient outcomes, helping to determine the most valuable healthcare interventions. Applying pharmacoeconomics to clinical decisions involves evaluating new treatments, determining resource allocation, selecting patients who will benefit most, and informing policy making. This ensures that healthcare resources are used efficiently and effectively. Challenges in pharmacoeconomic studies include data quality and availability, generalizability of results, ethical considerations, and appropriate time horizons and discounting. Addressing these challenges is essential for producing reliable and applicable economic evaluations in healthcare. Risk-benefit assessment involves evaluating the potential benefits of a medication against its possible harms. This is crucial for selecting appropriate treatments, especially for medications with significant side effects or for patients with complex medical histories. Factors in risk-benefit assessment include patient characteristics, disease severity, available alternatives, and patient preferences. Balancing these factors helps in making informed decisions about treatment options. Tools for risk-benefit analysis include clinical guidelines, prescribing information, decision support algorithms, and assessment tools. These resources help clinicians evaluate the potential risks and benefits of treatment options effectively. Case examples of risk-benefit assessment include anticoagulation in atrial fibrillation, opioid analgesics for chronic pain, and biologics for autoimmune conditions. These examples illustrate the practical application of risk-benefit analysis in clinical settings. Evaluating a patient's unique characteristics, including age, renal and hepatic function, comorbidities, and genetic factors, is crucial for initial assessment. Selecting appropriate drugs based on evidence-based guidelines and patient-specific factors ensures effective medication. Adjusting dosages according to patient response, organ function, and potential drug interactions is essential for dose optimization. Regularly assessing efficacy, side effects, and changes in patient condition guides further adjustments. Renal function adjustments are necessary for drugs cleared by the kidneys. Hepatic function modifications are needed for medications metabolized by the liver in patients with impaired hepatic function. Genetic factors should be considered for pharmacogenomic testing to guide dosing based on individual metabolism variations. Adjusting therapy when adding or removing medications that may interact with current treatments is crucial for managing drug interactions. Medication adherence involves taking medications as prescribed in the correct dose, at the right times, and for the appropriate duration. It's essential for achieving therapeutic goals and optimizing patient outcomes. Challenges include complex regimens, side effects, costs, health literacy, and cultural beliefs. Non-adherence can lead to treatment failure, disease progression, and increased healthcare costs. Improving medication adherence involves patient education to explain medication purpose, proper use, and importance. Simplifying regimens with extended-release formulations or fixed-dose combinations can reduce dosing frequency. Implementing reminder apps, smart pill bottles, or text message systems can aid adherence. Addressing barriers through generic options, patient assistance programs, or alternative therapies for cost issues is important. Scheduling regular check-ins to assess adherence and address concerns ensures follow-up care. Providing comprehensive information about conditions, treatments, and self-management strategies empowers patients. Tailoring communication to match health literacy and cultural background ensures effective understanding. Involving patients in treatment choices through shared decision-making respects their preferences and values. Teaching practical skills like proper inhaler technique or insulin injection methods builds patient confidence and competence. Electronic health records centralize patient information and decision support tools. Mobile health apps provide patient-facing tools for medication reminders and symptom tracking. AI-driven analytics offer personalized dosing and risk assessment. Wearable devices enable continuous monitoring of vital signs and medication effects. Physicians diagnose conditions and oversee overall treatment plans. Pharmacists optimize medication regimens and provide patient education. Nurses administer medications and monitor patient responses. Specialists provide expertise in specific conditions or treatments, ensuring comprehensive care. Continuous quality improvement in pharmacotherapy involves data collection on medication use, outcomes, and adverse events. Analysis identifies trends, areas for improvement, and best practices. Intervention design develops strategies to address identified issues or enhance processes. Implementation puts new practices or policies into effect across the healthcare system. Evaluation assesses the impact of changes and adjusts as needed. Future trends in pharmacotherapy include personalized medicine, tailoring treatments based on genetic profiles and biomarkers. Nanotechnology is developing targeted drug delivery systems for enhanced efficacy and reduced side effects. Gene therapies treat genetic disorders by modifying or replacing faulty genes. Digital therapeutics use software applications as part of treatment regimens. AI-assisted drug discovery accelerates the development of new medications through machine learning. Integrating the best research evidence with clinical expertise and patient values ensures evidence-based practice. Tailoring treatments to individual needs, preferences, and circumstances is the essence of patient-centered care. Staying current with evolving knowledge and adapting practices accordingly is crucial for continuous learning. Balancing individual patient care with responsible resource management reflects ethical stewardship.